Hello and welcome. Today we'll be discussing bladder fibrosis, a condition that can significantly impact urinary function and quality of life. We'll explore what it is, what causes it, how it's diagnosed and treated, and what the future holds for managing this challenging condition. Bladder fibrosis, at its core, is the formation of scar tissue within the bladder wall. While the exact cause can be multifaceted, common culprits include chronic inflammation from recurrent urinary tract infections, prolonged catheter use, radiation therapy for pelvic cancers, and certain autoimmune disorders. In some instances, the cause remains unknown, which we refer to as idiopathic bladder fibrosis. Understanding these potential triggers is crucial for proactive management. Let's dive deeper into the pathophysiology. Normally, the bladder wall is flexible and elastic, allowing it to expand and contract efficiently during filling and emptying. In bladder fibrosis, the chronic injury or inflammation triggers a cascade of events. Specialized cells called fibroblasts are activated and begin to produce excessive amounts of collagen, the main component of scar tissue. This excess collagen replaces the normal bladder tissue, leading to thickening and stiffening of the bladder wall. As a result, the bladder loses its ability to stretch and store urine properly, leading to reduced capacity and increased pressure during filling. Determining the precise epidemiology of bladder fibrosis is difficult, as it's often underdiagnosed and may be mistaken for other bladder conditions. However, it is more commonly observed in individuals who have undergone radiation therapy for pelvic cancers, particularly prostate or cervical cancer. Patients with long-term indwelling catheters are also at increased risk. While the exact prevalence remains elusive, it's important to recognize that bladder fibrosis can affect individuals of all ages, though it's more frequently seen in older adults due to the increased likelihood of risk factors like chronic catheterization or radiation exposure. The signs and symptoms of bladder fibrosis can vary depending on the severity of the condition. Common symptoms include increased urinary frequency, urgency, a sudden, compelling need to urinate, nocturia, frequent urination at night, and dysuria, painful urination. Due to the reduced bladder capacity, individuals may experience urinary incontinence, particularly urge incontinence. In severe cases, the fibrosis can lead to hydronephrosis, a swelling of the kidneys due to a backup of urine, which can cause flank pain and even kidney damage. Recognizing these symptoms early is vital for prompt diagnosis and management. Diagnosing bladder fibrosis typically involves a comprehensive evaluation, starting with a thorough medical history and physical exam. A urine analysis is performed to rule out infection. Urodynamic testing, which measures bladder function during filling and emptying, is a key diagnostic tool. Cystoscopy, procedure where a small camera is inserted into the bladder, allows direct visualization of the bladder lining and can help identify signs of fibrosis. Biopsy of the bladder wall may be performed to confirm the diagnosis and rule out other conditions, such as bladder cancer. While bladder fibrosis doesn't neatly fall into distinct types, it can be classified based on its severity or the extent of bladder wall involvement. It may be described as mild, moderate, or severe, depending on the degree of bladder wall thickening and the resulting impact on bladder function. It can also be localized, affecting a specific area of the bladder, or diffuse, involving a larger portion of the bladder wall. Understanding the extent and severity is essential for tailoring the treatment approach. The treatment and management of bladder fibrosis aims to alleviate symptoms, improve bladder function, and prevent further progression. Conservative measures include lifestyle modifications, such as fluid management and bladder training. Medications such as anticholinergics can help reduce bladder spasms and urgency, but may have limited effectiveness in severe cases. Intermittent catheterization may be necessary to empty the bladder completely. Surgical options, such as bladder augmentation, enlarging the bladder with tissue from the intestine or urinary diversion, creating a new pathway for urine to exit the body, may be considered in severe cases where other treatments have failed. Research into novel therapies, such as intravesical injections of medications to reduce fibrosis, is ongoing. Preventing bladder fibrosis focuses on minimizing risk factors, prompt treatment of urinary tract infections, avoiding prolonged catheter use whenever possible, and using radiation therapy techniques that minimize bladder exposure are important strategies. In individuals undergoing radiation therapy, medications may be prescribed to help protect the bladder from radiation-induced damage. Regular monitoring of bladder function is crucial, especially in individuals with risk factors, to detect early signs of fibrosis. The prognosis for bladder fibrosis varies depending on the underlying cause, the severity of the condition, and the individual's response to treatment. While bladder fibrosis is often a chronic condition, many individuals can achieve significant symptom relief and improved quality of life with appropriate management. Recent research is focusing on developing more effective therapies to reduce fibrosis and restore bladder function. Studies are exploring the use of stem cell therapy and gene therapy to regenerate bladder tissue. These advances offer hope for improved outcomes and a better quality of life for individuals living with bladder fibrosis.